Ben Bucher, and I'm a family nurse practitioner here at Tanner County Medical Center in Candu, North Dakota. So I'm going to talk to you a little bit about what a family nurse practitioner does, and then I'm going to show you a very common skill that nurse practitioners utilize often, and that is suturing a wound. So for most nurse practitioner programs, your first step is that you have to become a registered nurse. And so that involves 4 years of undergraduate college. And then you'll graduate with your BSN, which is a Bachelor's of Science in Nursing. And then from there you would go and work as an RN, anywhere from a minimum of 1 year to really as long as you wanted to be an RN. And then you would apply for graduate school, which then you would become a nurse practitioner upon graduating graduate school, and that would be your master's of nurse practitioner or a doctorate of nurse practitioner. So all in all, you're looking at anywhere from 6 to 7 years of college with 1 year in between where you would be practicing as an RN. So an RN stands for a registered nurse. And what that means is basically you would practice nursing. There is a lot of detail that goes into the scope of nursing practice. The main difference between a nurse practitioner and a registered nurse is that a nurse practitioner has the ability to practice independently, has the ability to make diagnoses, order tests, order x-rays, CTs, MRIs, and prescribe medications. Very similar to what a physician would do. There are a lot of universities and colleges in North Dakota that offer nursing school. I would say there's probably 7 or 8 in the state, as big as NDSU or UND, or as small as, for example, the Dakota College in Botno, if you wanted to stay kind of more local. And then as far as nurse practitioner schools go, they're located mainly in the larger communities, although now you are seeing a lot more virtual and online classes for nurse practitioner. So upon graduation, I've always worked in rural health. I think for a nurse practitioner, you have a lot of autonomy in rural health. It's a very exciting place to be. You can also work in the urban settings in larger facilities. I enjoy the smaller town practice because a lot of times you are the only one there that's providing care, which is exciting. And then if you work in a smaller facility, likely you're expected to work in the clinic, in the hospital. If there's a nursing home, you'd work in the nursing home, and then you'd also work in the emergency department. So when you're in the clinic working as a nurse practitioner, a lot of your practice is focused on management of chronic conditions and chronic diseases such as type 1 and type 2 diabetes, cardiovascular disease, hypertension, etc. And then you would see patients in the hospital. You would be admitting patients, rounding on patients, and discharging patients. You'd likely see patients over at the nursing home. Nursing home patients have a lot of chronic conditions that need to be managed, and so it would be on the nurse practitioner to do that. And then likely you would work in the emergency room as well. Larger facilities, if you wanted to work there, you likely would not be required to do emergency rooms. So if that's not for you, you may want to consider working in a larger facility. If you like the emergency room, then small town is for you. Depending on where you work, the pay range would be anywhere from $100,000 a year all the way up to about $300,000 a year. If you work in the smaller community, usually, which you might think is the opposite, but usually you end up actually making more in a smaller community because your responsibilities are greater. There's a lot of ER call that you have to take, and a lot of clinic hours you put in, and then you're rounding on the inpatients. A larger facility, mainly you work in the clinic, and if you were to admit a patient, you would admit them to a hospital of service. You probably wouldn't see the patient again. And if you have a patient that's critically ill, you'd send them to the ER, where then the ER physician or provider would take over. So when you're in the smaller community, there is more responsibility. So if you like that, if you like the autonomy, if you like a higher pay, and you like seeing a lot of variety of patients, then small town is for you. However, one drawback is that you are required to take ER call. And so for our team, that means one night a week you're on call, and call starts at 5 p.m. and ends at 8 o'clock in the morning. There's nights where you don't see a patient, you just happen to have a quiet night, and there's nights where you see 8 or 9 patients. So it all depends. And then for a weekend, our weekend call starts at 5 p.m. on Friday and ends at 8 a.m. on Monday morning. So there's a fair amount to call. The type of patients that you see range anywhere from acute injuries like a cut, all the way from coughs and colds, all the way up to major traumas, heart attacks and strokes. So you need to be prepared to handle those patients. So that's kind of basically the role of a nurse practitioner. And then we'll get into a skill that will come in handy if you do take the rural health road and do some emergency room work. Alright, so I am going to be showing you a suture technique, and this is called simple interrupted sutures. And so the first step I do when I have a patient with an obvious laceration is wear my gloves, and then I'm going to be anesthetizing the skin. Of course, you'd want to clean the skin with ChloroPrep or betadine or whatever your facility has. And then we'd be using 1% lidocaine is the numbing agent, very similar to Novocaine, just a different brand name. I'm sure all of you have had Novocaine at one point or the other. After I draw up my lidocaine, I will anesthetize the area. So basically what you're going to be doing is kind of starting right here. The first poke is usually the most painful, so you want to make the poke, inject lidocaine, and then you go on the opposite side, make a poke, inject lidocaine. And then the nice way to do it is when you've injected your lidocaine, it's nice to go where you've already anesthetized so that you're not having the patient go through 10 or 11 sticks, which are painful. So now that I'm going here, most likely the patient is not going to feel the stick of the needle. They might feel some burning from the actual lidocaine itself, but when you go into an area that you already anesthetized, it does work the best for patient comfort. So I would have gone all the way down this area with the lidocaine. Usually lidocaine is quite instant, but it's always good to give it about a minute to let the full anesthesia take effect. And then what I would do is I'm going to be putting on my sterile gloves. This is a sterile technique because there is a risk of infection anytime you're breaking the skin. And so we want to use sterile technique for this procedure. So we start with our gloves. And then making sure not to touch anything else, not to touch your other hand with your sterile hand. And so now my gloves, my hands are sterile. The inside of this package is sterile, so I can take this and remove it. And then we have our sterile field here, and this suturing kit comes out of a package which is sterile as well. So now that we have everything ready to go, we'll start with suturing. So when you have a laceration like this, you don't want to start at this end and go this way, because you might end up having the skin kind of move and shift, and then when you're done you might end up with an area that is quite elevated and doesn't line up. So a laceration about this size, I would want to start right in the middle and then work this way or work that way. So the first thing I would do is take my forceps and retract the skin, and then you take a bite of the skin, and then come up. Take another bite of the skin, which is about 1 centimeter, and then you bring this through and come to about there, leaving about 3 inches of suture material at the end. And for your first pass through, you want to grab with your forceps, you want to do 2 loops around, grab, and then pull through. And then you want to make sure that the skin approximates very well. You don't want to do it too tight where the skin is overlapping, and not tight enough where there's still an area that the wound is open. So once you do your first pass, the next few is just 1 loop. Grab, come through, and then go the opposite way around, because you want to make nice tight square knots. Come through, and then again down and through. And normally you would have an assistant in the room where you don't have to be putting your tools down, and you would cut, leaving about 1 centimeter of suture material. So you don't want this to get caught on anything, and you want enough where when the sutures need to come out, you have something to grab. So we would continue on with suturing. A cut of this size, I would say, is going to need about 8 to 10 sutures. So once again, this is the end of the wound here. This is where I've sutured. So once again, I would go in the middle, and then I would go here, and then I would go here to create a nice even suture line. So once again, you take a bite with your needle, come up through the wound, take another bite, come up, and then we'll make our loops again. So first loop is always going to be 2. And then you can just do 1. And you'd want to do about 5 or 6 throws to make sure that you get a suture that is nice and secure. So we'll do 1 more. And again, cut. And I'll finish with 1 more suture here. So as you can see, now my next suture is going to be here, and then here, and then here. Now, unlike the first ones that we did, because I'm getting close where the wound is getting completely closed, I'm not going to be able to peel the skin back and take a bite out of each side. So for this one, you kind of want to be at the end of your needle, and we're just going to go down and through the entire wound and then up. And that's just because we're running out of room, and I don't want to be pulling back a wound that is recently healed. So this time we just went underneath the entire wound and came up, and then the technique is going to be the same, where we go 2 loops, grab and pull through, and then you can use your hand too if you're not wanting to use. A lot of times with these small suture material, it can be difficult to grab with the forceps. Once you're in and you have one done, keeping in mind that you don't want to be getting cut by the needle, you can just use your hand, and sometimes it's a lot better. You'll get faster as time goes on, but you can see with that you can move a little bit quicker. One more. And then cut. And as you can see there, we've got a nice approximation of the skin on both sides. And if we were to finish the wound out, we would probably add 2 more here, and it looks like about 3 more there. Real quick, when the sutures are ready to come out, it is quite simple. You just go underneath with a scissors, grab one side, pull the other side out. So go in, pull up on the suture, cut, pull, and then for the last one, raise the suture up, place the scissors underneath the suture, one cut, and pull. And that's it. That is simple interrupted suture technique.